Oh, Councillor Best.
Good morning.
Good morning. How are you, Colin?
Thanks.
Good morning, Kim Majetic, Chamber Member. Nice to see you again.
Very nice. Good to see you, Kim.
Happy Friday, everybody.
Happy Friday.
Good morning, everybody.
Good morning.
Good morning.
So we've just got people joining us from the weight room, and then we'll get things underway.
Mike, you look very cool with that beard.
It's become a lockdown beard, so I'll just wait until everybody's vaccinated and we're out and about doing some normal stuff before I can return back to that. But yeah,
You look good though. It suits you.
I can't do this. I can't do the work on the top, so I have to do the work on the bottom part of the head. So
Eventually you can comb it over, Mike. And with that, I think we'll get underway.
You had to get that one on the recording now, didn't you?
Yeah.
Good stuff.
That's going to go on Kojiko too. So good morning, everyone, and thank you for joining us for this town hall with our MPP Parm Gill. For those who don't know me, I'm Scott McCammon, President and CEO of the Milton Chamber of Commerce, and we've been very fortunate through the pandemic to have access to our political leaders to talk through the issues and hear concerns, and we're going to be doing that again this morning. I'm not going to do a huge introduction of Parm because most people I think know him, but I will give a little bit of background because I think some of that does give some good context as well. So Parm has been our MPP in Milton since 2018. And prior to that, serving as an MP in Ottawa from 2011 to 2015. And prior to Parm's work in public service, he was involved in numerous family businesses, including manufacturing and the hospitality industry, and studied at the Ivy School of Business at Western, and has a master's in business administration. In his political life, Parm's been involved in various portfolios, including such things as Veterans Affairs, Public Safety, and International Trade, and he's currently the Parliamentary Assistant for Housing to the Minister of Municipal Affairs and Housing, and is a member of the Standing Committee on Justice Policy. And I tell you all of that because I think all of those experiences combine to give Parm an important perspective on the pandemic. He sees it not only as a fellow business person, but also a restaurateur, and because of his work in trade and public safety, I think all of those give him a great background. And I can tell you from a chamber perspective, right from the beginning of this pandemic, Parm and his team have been incredible allies. We've worked very closely together to reach out to local businesses to understand their challenges, and also to share information as quickly as we can on government assistance programs and government actions. And I can tell you, as Parm is a Milton resident, one of his main priorities is helping constituents. And that segues perfectly into the town hall this morning, because as we started planning this town hall a number of weeks ago, we were going to be talking about the provincial budget, which was released recently, and we're still going to do that. But because 2 days ago the Premier announced the stay-at-home order and lockdown for the next 28 days, in those types of circumstances, Parm obviously is now even busier than before, and it would have been understandable if we needed to postpone this town hall because of the shifting of priorities. But Parm wanted to continue with the town hall, feeling it's more important than ever to have these forums to hear your concerns, answer questions, and just talk through what's happening with the lockdown. And again, talking about the budget and some of the things that are there to help business people. So with that, Parm, I will turn it over to you. And thank you again for joining us.
Well, thank you very much, Scott. It was very kind of you. And thank you for that very kind introduction as well. And I certainly appreciate all the work that yourself, your team at the Chamber have been doing the whole time. You guys have existed, but especially during some of the challenging times over the last year or so. And, and as you mentioned, it's been under the circumstances, I would say it's been, great to be able to work with all of course, the constituent small businesses, but also your team and everything you guys do to support our local businesses here in Milton. So I think you guys deserve a lot of credit also for being able to host some of these Zoom meetings, sort of town hall meetings. So we have an opportunity to, of course, share our information with small businesses, constituents, and also be able to hear some of the concerns directly. So thank you for all of that. Guys, we all know we're going through some of the most challenging times, I would say, we've seen for a long, long time. But I do want to thank everybody for everything that they've done, their part to make sure that we're able to eventually put this COVID-19 behind us. And this pandemic, unfortunately, has been our enemy for the last year or so, and we're making progress. The other thing I would say is, we're not unique in a unique situation here in our province of Ontario or town of Milton. This pandemic is affecting lives throughout the world. And to an extent, I would say in some ways, I think our town, our province, our country has done well compared to some of the other jurisdictions. But anytime, lives are affected, business are affected, economy and the other ways of our lives, obviously it doesn't go well, and it hurts us in more than one ways. I also want to thank all the frontline workers for everything they're doing, basically, putting themselves in harm's way to protect us. At the end of the day, nothing I would say can replace personal responsibility, and I think at least in the town of Milton, the province of Ontario, I think the residents have been doing their best in terms of protecting themselves and protecting their family, friends, neighbors, co-workers, and so forth. So thank you for that. As a government, we have a duty to protect Ontarians, protect public health, and especially during a crisis. And that's been our main focus, at least for the last year, and will continue to be our focus, until we're able to put this behind us. And that's what we had to do. That's what we'll continue to do. Obviously, I think we can all appreciate and understand that, lockdowns sucks. I don't think anyone likes lockdown. That's no secret. But unfortunately, it is necessary at times. And, these decisions are never made lightly. They're never made easy. There's a lot of thought process, consultation, that go into making these decisions. And I know at times people think it's just Doug Ford, or it's, their MPP or their MP or whatever other levels of elected officials are making these decisions, and, they're doing it to hurt people. No, absolutely, that's not the case. And I think, as a matter of fact, something that we've, as a country, we've done really well over the last year, say, is being able to work collaboratively with other levels of government, be federal, be regional, municipal, obviously at the provincial level, and all in the interest of the people that we serve. And by taking some of these measures, putting them in place, we've bent the curve before, we've slowed down the spread, and I have every confidence that we will do it as more and more vaccine obviously comes online and more people are vaccinated, soon. I think now, sooner than ever, we'll be able to put this behind us. There are, as Scott pointed out, the initial objective of this town hall was actually the budget that the Minister of Finance released recently, and we were going to talk about that, but circumstances have changed, and unfortunately, this is continues to, the COVID-19 stuff still continues to be sort of front and center for the time being. And this virus is different from what we had initially. I think we all understand that. And I have some of these slides that I want to go through with you guys initially before we kind of get into the budget stuff as well. Just, so you guys have a perspective in terms of some of the stuff that we're privy to at the provincial level that is shared with us by the command table and the recommendations from the medical community that are provided to our government. And based on which, some of these decisions are made. This isn't complete, but I just picked a few of the relevant slides, and I think that you guys should see. This is going back, I would say probably just over a week out. So these aren't necessarily most up to date. This was the presentation that was provided to us, I believe last Thursday. So they're about a week old. You want to bring that up, Robert? Yep, I can see it. So this first slide basically just kind of gives you an idea in terms of a timeline and the cases, how they've been increasing, and most new cases are coming from the variants of concern. They're not your previous COVID-19 strain. So this is different. So if you look at the graph, especially sort of the top line, towards sort of mid-December, where we were when we had to go into a lockdown, and you saw the initial uptake, but eventually with the lockdown, the curve then started to come down and came down significantly to the end of January, sort of, mid-February. And since then, it started to climb slowly, then back up as we came out of the lockdown and we started to open things back up. But then if you look at where the curve was, say, mid-March, and then started to go up beginning of April. And obviously, like I said, that curve has gone up over the last week significantly since we had to put some of the lockdown measures in place. So that gives you sort of some idea in terms of, do lockdowns work? Absolutely, they do. They're obviously something that no one wish that we had to do, but it's the unfortunate reality. Next one, Robert. So COVID-19 patients admitted to ICU continue to get younger. So if you look at the graph on the left-hand side first, that's a 1 week information from December 14th to 20th. And this is just kind of the average. So even though it's a snapshot of a week from December and a week mid-March, you can see in December, only about 30% of the ICU admissions were from ages 0 to 59, and then everything else was 60 plus. That graph is starting to switch. So the graph on the right-hand side, you can see we're almost, in mid-March, we were at about 50-50, 46% of the cases between ages of 0 to 59, and then, the remainder 54, 60 years and plus. And like I said, that's mid-March, but if you were to look at the current ones, majority of the cases are now coming from age groups 0 to 50, believe it or not. So that's obviously it's an area of serious concern, and also the stress that it's putting on our ICU capacity in general. Like, we're bursting through the seams. It's getting to a point where unless we take the steps that we're taking, it will become unmanageable. Next slide, Robert. So you can see, obviously, the variants of concerns have more severe consequences and are more fatal. So just in terms of a hospitalization, compared to the previous strain, it's basically 1.5. So initially we had, for every 10 hospitalization, now we're looking at roughly 15. ICU admission, so the previous one, was 10, now it's 20. So the ratio is basically 2 to 1. The death rate with the variants of concern, you can see that that's also 1.5 compared to the previous strain. So some of these, the numbers are really, really, really concerning. Next, Robert. So some of the key findings, obviously, the third wave is here and being driven by variants of concern, and that's majority of the cases now. Younger Ontarians are ending up in hospital. Risk of ICU admission is 2 times higher, as I showed you on the graphs, and the risk of death is 1.5 times higher for the B.1.1.7 variant. COVID-19 threatens, of course, our health system, ability to deal with regular ICU admissions, and the ability to care for all patients. School disruptions have a significant and highly inequitable impact on students, parents, and society. So further disruptions should be minimized, and part of the reason why we're trying to keep as many schools as possible, because even to this date, with all the protocols that have been put in place, but 99% of the schools are safe. There are some that have had cases. Of course, I mean, even those are coming from the community spread, not necessarily being spread in schools. So stay-at-home orders will control the surge, protect access to care, and increase the chance of summer Ontarians all of us want to be able to get out and do things and have a normal life. I think with some of these restrictions that have been put in place, it will eventually get us there. Now that we finally have a fairly reliable supply of vaccines arriving in Canada, as most of you have probably seen the press conference of the Premier, the Minister of Health, and in the media, we're ramping up our vaccination program to a full capacity using all sorts of different methods, mobile vaccine unit, going to large employers, and also prioritizing some of the communities, obviously, that have a high rate of spread. So we're making changes as needed to make sure that we're able to put some of the fires out where the fires need to be put out first. And that brings us to basically our initial objective for this town hall, which was the Ontario's Action Plan Budget 2021, and we'll go through some of the highlights and be happy to take any questions afterwards. I also wanted to let you guys know, I actually mentioned this to Scott offline a couple of days ago. So I was talking to the Minister of Finance, and I told him that we were doing this town hall. He wanted to get on this, but unfortunately he was appearing before the Finance Committee at the same time today, so was unable to join us, but he does want to speak to Miltonians, and we're working with Scott and his team to find a time that, of course, works for the Chamber and also the Minister. So in the very near future, we will have Minister of Finance and my colleague Peter Bethenfall come and join us and be able to share more of what his vision is and some of the measures that he's introduced in this budget and how they'll help Ontarians, of course, protect health and economy. So the two guiding principles of this Ontario Action Plan or focus is protecting people's health and our economy. Those are the two key pillars. And the budget, of course, outlines Ontario's next steps to defeat COVID-19. Ontario's total response to COVID-19 to date has been $51 billion. I think, especially, most of the people that we're talking to today here are from the business community and understand deficits and understand debt. It's not something that the Premier or government would like to do, but I think under the circumstances, we are forced to run probably one of the largest deficit and also incurring, to an extent, I would say, a massive amount of debt, but necessary debt. I don't think there's any way around it. So total investments of $16.3 billion to protect people's health, and $23.3 billion is to protect our economy. And the 2021 budget introduces additional measures that provide, of course, direct support for families, for workers, and small businesses. Next, Robert. So Ontario is providing an additional round of support through the Ontario Small Business Support Grant worth approximately $1.7 billion. And the grant will now deliver an estimated $3.4 billion to approximately 120,000 eligible small businesses in Ontario, helping them through this difficult time and, of course, while protecting jobs. Grants for tourism, hospitality, culture, and supports. Obviously, I think we can all recognize this is the sector that has been hit the hardest. So in response to the unique challenges these sectors are facing, we've announced a wide range of initiatives to help the tourism, hospitality, and culture sector survive the COVID-19 pandemic and thrive in the future. So in 2021 budget, Ontario is investing more than $400 million over the next 3 years in new initiatives to support these sectors. This builds on investments of $225 million announced earlier, bringing our total of more than $625 million since the pandemic began. Ontario is introducing a new Ontario Tourism and Hospitality Small Business Support Grant, which will provide an estimated $100 million one-time payment of $10,000 to $20,000 to eligible small businesses. And eligible businesses include things like hotels, motels, travel agencies, amusement, water park, hunting, fishing camps, recreation and vacation camps, and so forth. So including children's overnight summer camps and things like that. Additional grants are also available, as some of you might have taken advantage of some of these already. Main Street Relief Grant for personal protective equipment, providing up to $1,000 for PPE costs to eligible small businesses across Ontario with 2 to 19 employees. Property tax and energy costs rebate grant for businesses that were required to shut down or significantly restrict services due to provincial public health measures. So all of these supports are still available for businesses, and this is, of course, a provincial application-based grant provides a rebate to eligible businesses in respect of a property tax and energy bills. And if any of you do require additional information on these grants, of course, we're happy to help you here at my office. So feel free to contact us on that as well. How to apply for the grant? Of course, apply through the COVID-19 Business Support Grant by going to gov.on.ca. So here's the website, and you'll get all of the information, details on the website, and kind of step by step walk you through. And you also have the ability to check the status of the application through the portal, and also able to edit applications, and can also email the team at Small Business Support Grant Ontario.ca. So the email address is also provided to you guys. So in terms of the vaccine rollout plan, of course, we're in phase 2, and it just kind of shows you what phase 1 was and what phase 2 that we're currently in looks like, and eventually we'll be able to get to phase 3. This is, of course, key to defeating COVID-19 and ensuring every person who wants a vaccine is able to get a vaccine, working with partners, including our federal government and local public health units, to vaccinate people of Ontario in the government's most urgent priority. Nothing at this point in time is more important. Our government is investing, as pointed out earlier, more than $1 billion as part of Ontario's vaccination plan, beginning in 2020-2021, to support the administration, distribution, and the rollout of Ontario's COVID-19 vaccination campaign, including $50 million to support vaccinations in First Nation and urban Indigenous communities. That kind of shows you again just the different phases. And as I mentioned, we're currently in phase 2, and we're slowly changing sort of the age groups with a 5-year increment, and of course high risk congregate settings, example shelters, community livings, and other manufacturing and food processing and other essential worker facilities are at this point in time kind of top of the priority for the government to be able to vaccinate people and of course, individuals with high risk chronic conditions and their caregivers, and those who cannot work from home, at-risk population in general. Like I said, hotspots within our communities. You guys probably have seen all the different postal codes that have we've released. We're targeting those postal codes and getting them in terms of the rollout to various different pharmacies and different communities as well. So we're deploying all of our different partners, and we want to get as many people vaccinated as possible. This is kind of the rollout gives you a snapshot. So to date, Ontario has administered just under 3 million vaccines, 2.8 to be exact, with 326,000 people that are fully vaccinated. So with their dose 1 and dose 2. The province transitioned to phase 2 of the rollout plan on April 6, 2021, and the groups eligible under phase 2 includes various different groups that are listed below. Next, Robert. So as I pointed out earlier, so we got various different methods that we're utilizing, including mobile clinic. A lack of mobility or transportation should not prevent anyone from getting a vaccine. So to an extent, we're going to be sending out teams door to door, especially where there's a significant senior population, and remove any sort of barriers that prevent people from getting vaccinated. Next, Robert. That's it. Thank you very much, and happy to answer any questions if anyone has. I think we'll turn it back to Scott.
That's perfect. Thanks, Parm. Thank you for the overview, both on the budget and on vaccinations. A reminder to everyone that's tuned in that the chat room is open. So if you have any questions, just post them there, and then we'll get to them as soon as we can. We also had a number of people that had pre-submitted questions, so we'll try and get through those as well. But Parm, first, I want to come back and talk a little bit about the vaccination rollout. You talked about the hot zones and postal codes. In Milton, we have L9E, which is a huge area in terms of Milton geography, essentially wrapping itself as a U shape around downtown Milton. So there's been some confusion in terms of what that means. I know the priority is to get to the residents in L9E, but we do have some businesses in that postal code. We have some businesses that are just on the shoulder of that postal code. So there's a question about whether any of their employees can be vaccinated, especially where you talk about, the rollout to manufacturing and to food processing. You've got someone like Sergeant Farms that is not L9E, but is on kind of the shoulder of that, but is food processing too. So how do we address all of those questions?
So especially when it comes to sort of essential businesses, frontline workers, items like, and we've been in contact, regular contact with places like Sergeant Farms and others that are, obviously essential, that needed to run and operate and continue to operate in order to keep our supply chain going. So the province is working with the local public health units to in some cases deploy units directly to their facility to be able to vaccinate their employees. So it's the least amount of disruption in their lives and the businesses. That's one. So in terms of the postal code, unfortunately, there isn't a perfect solution. There are going to be places that are on the other side of the street, or for whatever reason, or aren't captured by a postal code. And we're slowly working our way through by working with the local public health units and addressing some of the hot spots, as I mentioned earlier, that, knowing full well that, cases are coming from certain postal codes, and there is an increased risk in the particular postal code. So we need to address that first. But rest assured, as the Premier pointed out, I mean, our focus is to vaccinate as many people and as quickly as possible, especially now that we have a decent supply of vaccines, and we're mobilizing it more and more of our partners to make sure that happens. There are a number of pharmacies now that are online in Milton as well, and the region of Halton, that will be vaccinating people. Eventually, we're getting out to the medical community in terms of your doctor's offices and other places. You also be able to go and deploying the mobile unit and setting up shops at some of the large employers. So all hands are on deck. This is literally is the top priority for the government. So our objective is over the next, say, month or so, to be able to vaccinate majority of the people that want the vaccine, they be able to get it. And we want the least amount of disruptions, especially when it comes to essential businesses, places like Sargent Farms that are in the food processing business.
So again, in L19, we've got companies like DSV, which have upwards of 1,000 employees. And I know the province has, to a certain extent, engaged the 34 public health units across Ontario to deal with the rollout and how it's done within each jurisdiction. And this is a long question, but we, through the Ontario Chamber, we also have the Ontario Vaccination Support Council. So the business community is trying to figure out how we can help in terms of the vaccine rollout, and whether we can deploy companies like Gordon Food Service, where Kim has posted a question in the chat. That they have on-site medical staff that could assist. So with companies like Gordon Food Service, with companies like DSV, how can they get engaged to make sure that that their employees get vaccinated?
For sure. Let me just say a couple of things about DSV first. I mean, obviously, we know we're really happy to have DSV here in Milton. I think most of us have been there and seen their operation. And I'm also proud to say that the province of Ontario is using DSV as sort of the distribution center for the province in terms of sending out PPE to places throughout the province. So we've taken up a significant portion of their facility and rolling out trucks in and out of that place every single day. The second point, as we all know, they moved here from Brampton, so a significant amount of their workforce is still traveling from Peel or from Brampton to Milton to this date. So that obviously is sort of a unique situation that we're obviously aware, and places like Gordon Food Service, you mentioned, Scott, it's if they have a sort of a medical team also able to assist. I am happy to also take this back to the ministry and of course work with our regional health unit to make sure that they are able to provide the system. We can use all the system that we can get at this point in time, and there may be ways that we're able to utilize that and also expedite some of these vaccination sites and getting these businesses and their employees vaccinated as quickly as possible. So I'll take that back.
And I think part of it too is that it's dependent on supply. So, the more supply we get, the more vaccination sites we can have. But, at the moment, through, the 4 vaccination centers the region has set up and the pharmacies, we may not be ready to roll out to business yet. But at the same time, business wants to help and needs a certain amount of notice to get their operations set to do vaccinations as well.
That's a great point, and I just wanted to make a point. Sorry to cut you off, Scott. And I know there are people, including unfortunately, some of the elected officials from in and around the region of Halton that have been pushing this idea that there are vaccinations that are sitting in the freezers and the premiers and handing them out and whatever. I don't know how it would benefit the premier or the government in any shape or form by keeping these vaccinations in the freezers. But my point is, the head of the federal vaccination task force, Major General Denny Fortin, was asked a question by the media yesterday, and he was very blunt. And there was an article in the National Post, and I'm happy to share it. And he made it absolutely clear. Listen, I mean, all the provinces and territories are doing everything they can to get these vaccinations out as quickly as possible. There are no vaccinations sitting in any sort of freezers, but the group that we're talking to here, I mean, the business community, I mean, they understand how distribution works, how supplies work, and there are always going to be some supply that has been allocated that is either scheduled to go out or is on its way out, and so you're always going to have some quantity that is there that hasn't injected into people's arms, but to turn this into somehow a political issue, I think it's unfortunate. We've done a good job overall at working together with different levels of government, so let's just continue to do that. And I discourage everybody from trying to play politics with this important issue.
I want to come back to the budget to a certain extent. You talked about the small business support grants. And that has had a great impact on a lot of Milton companies in terms of accessing the funds. And we know that people that had the first round of funding automatically were enrolled for the second round of funding. And this is probably more of a question for the Minister of Finance. So maybe we'll defer to that meeting in a few weeks. But it just strikes me that the second round of funding, the application portal closed on Wednesday or April 7th, so 2 days ago, the same day that the Premier announced the lockdown to start yesterday. So a lot of small businesses were caught off guard, and if they weren't in the first round of funding, they may have missed the opportunity to apply for the second round. So I'm just curious about whether that portal will reopen to try and capture more companies.
So absolutely. I mean, we are working on items such as that, and I can tell you that behind the scenes in our caucus, we're having discussions there, and we will probably have something to announce on that without getting into details, Scott, in the near future. And I will have the minister as well, probably over the next week or two, to come and speak to the business community directly, and hopefully by then we'll have a news on that item as well. We're aware that the portal was closed and obviously kind of run out its time, but sometime, unfortunately, in governments, things don't quite move at the speed that we like it to, with all the bureaucracy, everything that's involved. But we're fully aware of some of the challenges, and we want to do everything we can to provide the necessary support to our small businesses, which I always say is, as a former small business owner, I understand firsthand some of the challenges, and also small businesses are the backbone of our economy. I mean, there's no secret of the country, so we got to do everything we can to help and protect and provide the necessary support.
Parm, you also talked about the tourism grants, and we have a question about that related to short-term rental investment owners. The hotels and motels are treated differently than the short-term rental properties. Is there any relief for those types of businesses?
I would have to look into it, to be honest with you. If whoever has the question, if they want to just send my office an email, I'll get my team working on it and we'll get the exact details. I'm not entirely certain if short-term rentals are captured. We'll be happy to look into it and provide an answer on that.
During the pandemic, you mentioned this too, but the hospitality industry, probably more than any other sector, along with gyms and things like that, have been really affected negatively. We saw sort of that light at the end of the tunnel in terms of restaurants being able to open a little bit. We were moving into patio seasons and trying to look at opening patios sooner. And now those have all been shut down again because of the lockdown. But in some ways, there's an argument that the patios are probably safer for some people than going into some retail locations. So is there consideration for things like that in terms of allowing the restaurants to pivot a little bit and reopen?
First of all, all I'll say is, none of these decisions are made lightly, and believe me, it pains all of us when we have to come out and say, you can't open a patio, or you can't open a restaurant, or you can't open this, and you can't open that. Especially as a former, restaurant owner myself, and I can only imagine what the restaurants are going through. And there's a sort of a belief out there that the restaurants industry makes a killing, and the margins are high. They're not. I can tell you firsthand, they're not. The amount of hours you put in and everything else, and the liability that you carry, it's, I really, really do feel for them. What I would say is, Scott, it's ultimately, of course, it's the Premier's decision, is the government that has to take responsibility. But we do have to, and we do rely on the medical professionals. We do have a command table that provides us in important advice in terms of the direction, in terms of what should and shouldn't be open. And it is based on all of those items that these decisions are made. The Premier himself is a business owner, I'm sure everybody knows and understands the challenges. And we'd be crucified if we were to go against the advice of our medical experts. The Premier has said this on camera himself. I mean, it's not a decision that I or anybody else, any elected official would have liked to make. I'm sure I speak for the other two of my colleagues that are on this call, Mike Cluett and Colin Best. But we do have to listen to our medical experts. That's why we have them in place. The only thing I can say is that let's hope that we can vaccinate as many people and as quickly as possible so we can get our lives back to normal. I pain for the restaurant industry, just the hospitality industry in general. Not easy, very difficult. These decisions aren't made lightly, is all I would say. Is I'm really lost for words.
Parm, we talked earlier about the vaccination rollout and trying to get employees vaccinated. There's a question in terms of how the employers can strongly encourage their employees to be vaccinated, so that everyone in the same congregate environment in the workplace has a measure of safety, but also then having the employees prove that they've been vaccinated. So it becomes a bit of an issue in terms of whether they need to show any proof to their employer. But obviously the employer wants to make sure that anyone coming into their workplace is ultimately vaccinated.
Yeah. So, it's honestly showing leadership. It's encouraging everybody. As most of you know, the Premier is rolling up his sleeves today. He's getting vaccinated. The Minister of Health has already received a vaccine. It's letting people know that it's safe. It is safe for them to get the vaccine, and they should get the vaccine. And we encourage everybody to get a vaccine. Unfortunately, no one can force anyone to get a vaccination. That's just, how things are. We don't do that. We don't forcefully vaccinate people. And there will be certain employers where it will be required for one to be vaccinated, and that eventually that information will be rolled out. At this point in time, we are encouraging everybody to, if you're in a leadership position, show leadership, encourage everyone to get the vaccine. But if you're obviously an employee, and especially in a high risk environment, please get your vaccine as quickly as possible. But to answer your question, Scott, at this point in time, unfortunately, it is voluntary. It's not something that can be forced upon people. And I don't think any level of government would want to force this upon people. If they choose not to ultimately get a vaccine, then that's sort of their right.
But is there a way that employers can get verification of those that have been vaccinated?
We are working on that. That is something that the province is working on, where you would be able to potentially be able to show, and depending on what the requirement is, that yes, you've been vaccinated. So things like, if you're taking a flight in an airline, or if you're going into a particular environment, you need to show that you've been vaccinated. Yes, so Minister Monty McNaughton, Ministry of Health, and some of our other colleagues are on it already. So that'll be rolled out eventually.
So there's a question coming back to the support grant and those people that are getting the second round of funding. When can those companies expect to get the deposits in their accounts?
So it's part of the budget, as you know. So the budget is before the legislature right now. It has passed second reading. We voted on it. It's before the Finance Committee now. We're heading back to the legislature next week. The debate will start on a third reading. So once the budget passes, it becomes law. Then all of those supports will be rolled out. So it has to be passed in the legislature. So to answer your question, before those payments could be seen as going into people's bank accounts. So, and I am quite hopeful that probably over the next week or two, the budget will pass third and final reading in the legislature and become law.
Thank you. Rachel from the Downtown BIA is asking, once we get through these challenging times, businesses will continue to require support, flexibility, and an accommodative regulatory environment in order to give them time to recover and rebalance. Can you speak to the ways that your government hopes to continue to support businesses once we enter that recovery phase?
Yeah, so absolutely. As I pointed out in my presentation, the main focus at this point in time for the government, and I think it will be for some time, is protecting people's health and our economy. And we're going to do everything we can in our power to, of course, support our economy by supporting our small businesses, making sure that they have the resources and necessary supports that they require. Ultimately, they are the backbone of our economy. There's no denying that. So we need to make sure that they're successful. If they're successful, we'll have a successful and a vibrant economy. Obviously, we'll have jobs. We will have healthy communities. We solve a lot of problems by doing that. So that is going to be front and center for a while until we're able to get the economy firing on all cylinders and making sure that this pandemic is behind us. So that will be our focus, Rachel. So for the coming, not just months, I would say years.
We had a question pre-submitted talking about the horse racing industry, and I mean the nature of this has probably changed a little bit under the lockdown, but the question was related to why horse racing is not allowed without spectators during. Why is horse racing not allowed without spectators during the latest lockdown? So I think I gave you that question in advance. So I think you've seen the context.
Yeah, I have, and thank you for that. And I've had a number of discussions since with Jessica Buckley, of course, from Mohawk, and others from the industry, and they were doing well. And I understand the argument being that there's the same people that are working there to take care of the horses are the same people that are obviously that are responsible for races and other things. And but as I mentioned earlier, it isn't a decision that Parm Gill or Premier Ford or Minister Elliott has to make. These decisions are made with the advice from our medical care professionals and the command table. And at this point in time, they just felt that there needed to be a hard lockdown, stay-at-home orders, and that unfortunately included the horse industry. But I would say, let's just hope that, over the next 3 weeks or so, we're able to vaccinate enough people and we're able to put this behind us and never have to look back.
The next question relates to the nature of the lockdown and what people, I guess, can and cannot do. The Premier has made it very clear that people should stay home and only relieve their homes for essential reasons. We have one person that has a cottage up north that is under construction and needs him to be there to supervise some of that. So are things like that permissible under the lockdown?
So yes, and I did get that question as well in advance. So thank you for that, Scott. Absolutely. My interpretation of what's going on is, yes, we're not preventing people from going to cottages either. What we're encouraging them to do is go directly from your place there. Don't go roaming around. Make sure you have enough groceries and make sure you keep your distance and make sure you stay safe and keep others safe. So in this case, an individual has important renovations that need to get done in a certain time frame. I would say yes, that's absolutely is allowed, and person is able to travel and monitor renovations, again making sure that they stay within their premises and not go out wandering or talking to or meeting with other people or visit different places. That would be fine.
The pandemic in some ways has reinforced the fact that in some areas of Milton, we have very poor access to the internet, and and probably up in your neighborhood as well. But I know the provincial and federal governments have been making more and more announcements in terms of how we're solving that problem. And I just wanted to give you the opportunity to talk a little bit about broadband rollout.
I appreciate that. And as you pointed out, Scott, I live in rural Milton, so I experience firsthand. I also have 3 kids and wife that is working from home and kids studying from home. One's in university. And so you can imagine. I announced a number of months ago a program that's provincially funded in tune of $63 million with Sengen and Mage Network. They're in the process of putting their network in place. So that'll take care of sort of the north rural part of Milton in and around Brookville area and Nassagaweya and places like that. I know the federal government also with our MP made an announcement recently. I think that covers south end of Milton. Provincially, we've made the largest historic investment in broadband. Previously, it was over $1 billion. In the budget that we recently introduced, we allocated additional $3 billion on broadband. So altogether, we're putting $4 billion to get Ontario connected to reliable internet. And this is probably by far the number one issue that I bring up at Queen's Park in the legislature is the need for reliable internet service. Is something that I heard loud and clear during the last election and that I've been working very, very aggressively on. Obviously, the results are not overnight, unfortunately, but we're making a great deal of progress. All as I can say is, I always tell my colleagues, like, can you imagine Milton is part of the GTA? And if Milton doesn't have a reliable internet, or parts of Milton, you would not believe, even sort of the north rural part, there are places where you don't get cell service, let alone internet. So it's an issue that I have been working very, very aggressively on. And listen, we're investing a record amount of resources in this. And I am hopeful that in the very near future that hopefully this is an issue that we can, at least in Milton, put it behind us. Ideally, I'd like to see all of Ontario covered, but we're making tremendous progress, and we'll get there. I would say not slowly, but I would say in the very near future. Mage Network is actually in the process of installing their infrastructure, putting in place, and some people will start to come online as early as this month.
You talked a little bit about university students. I don't want to steal any thunder from any upcoming announcements or things that may be happening down the road, but obviously there's a lot of interest in terms of what's happening with Laurier and Conestoga. Again, not to steal any thunder, but can you provide a bit of an update?
Absolutely. And first and foremost, I want to thank my colleagues at the municipal level here, obviously, for working with us as well. And this has been an issue that I've taken on shortly after getting elected. Not trying to be political here, but there, previously there were announcements made, and when I took over and I started digging into the issue, and unfortunately we found nothing signed or no commitments. All it was, unfortunately, by the previous Liberal government was empty announcements leading up to an election. That's all we found. It was a $90 million that was announced. Of course, under the circumstance at the time, what we inherited, we had to roll that back, not just here in Milton, but also in Brampton and in Markham with York University. And we've been looking at ways of, bringing in our private sector to find solutions without taxpayers' money. And I think we are almost there with Conestoga, with Laurier, long-term care beds, with Sligo Village, of course, 192. And I recently announced an additional 406 long-term care beds. So altogether, we're getting over 600 long-term care beds. We will be getting Laurier University. We will be getting Conestoga College, also working on hospice that is much needed in the community as well. Some of the details, Scott, that I'm unable to share everything, obviously, at this point in time. But what I would say is, had we not been in this pandemic, people would have found out, would have heard, or some of the announcements or our plans already. But I am hopeful that as soon as we come out of this lockdown in the next 3 weeks or so, shortly after, we will reveal our plan in terms of not just Laurier, but Laurier, Conestoga, the long-term care beds, hospice. So there are a number of items, and we have made a significant amount of progress, real progress that will deliver results for Milton. And I'm very excited about it.
Parm, as the program comes to a close, I want to first of all thank you for taking time to do this town hall. As we said at the beginning, we planned on doing a post-budget briefing, and we've done some of that today. But I appreciate your willingness to shift and even during these very busy times for you, still do a town hall to talk to the business community about the COVID. So thank you for your accessibility, and I'll let you have the final words.
I appreciate it. And honestly, it's truly, for me personally, it's been an honor and a pleasure to be able to represent our community at Queen's Park as part of the PC government. And I really, really appreciate that every single day. It's been an honor to work with my constituents, small business organizations, such as yourself, Scott, that really do some amazing work. And I really want to thank the small business community for doing what you've been doing over the last year, and some of the struggles that you faced. We recognize that. We'll be there. We'll work with you. We will get through this, is all I would say. And I'm also really looking forward to having the Minister of Finance. He's a great guy. Honestly, he's a friend. And of course, the Minister of Finance, Peter Bethenvolly. And we'll get him in and also answer some of the direct questions, and we have the opportunity to hear directly from him. So let's find a date, Scott, over the next week or two and get him here. I think he'd be very, very beneficial to Milton. Thank you.
I totally agree. And I thank you for making that happen as well. And for those that are listening, just watch your chamber e-newsletter. We'll have an announcement hopefully in the next week or so about when the minister will be here. So with that, again, Parm, thanks to you and your team for being accessible and for coordinating this, and to everyone, please get vaccinated as soon as you're able to. Thanks very much.
Thank you so much. Thank you.